One, two, three, live. Hello, my name is Justus Jones. I am speaking today about the long-term treatment of ADHD, particularly adult ADHD, the dangers, the benefits, and the truth. I am an authority. The reason being is that, no, I am not a psychiatrist, but I have read every single thing there is to read about the disorder, and I've been taking the drug Adderall since 1994. I recently have been diagnosed with cardiomyopathy, which is basically means that I have 10 years left. It's when your heart becomes muscle bound. You see, Adderall and other stimulants all increase the beats per minute, your heart rate. It's called tachycardia. And the drug companies will tell you that they say that, yeah, it does it raises the diastolic and the systolic blood pressure slightly, when it really raises the diastolic blood pressure dramatically, and your pulse. And if your heart beats faster, everything, if you take a light switch and you switch it on and off, it's going to eventually, the more you switch it on and off, eventually it's going to wear out. Well, this is it. You know, I don't want to let you down, but you're hellbound if you continue to take Adderall and Vyvanse preparations. It will not work. It will shorten your life, and you will die prematurely. Now, in this information disclosure, what I'm about to tell you is to get a heart sense exam to check for any pre-existing cardiovascular defects before you continue using this medication. Now, how are you going to stop using this medication? You're going to have to do it gradually. Titration is the word. That's the word. You're going to have to gradually titrate off the drug, or you could possibly have a massive heart attack. Okay? So how do I do that? How do you do that? Well, very simple. Adderall happens to be one of those drugs that comes in many different strengths. 2.5 milligram, 5 milligram, 7.5 milligram, 10 milligram, 12.5 milligram, so forth. The duration period that we're going for, the duration, not the duration of effects, but this is the period before complete discontinuation, is 12 months. And it's very gradual. Then from there, if symptoms are too bad, we could possibly continue the medication with blood pressure medication. Okay? And in agreement with your doctor that there's no smoking in a diet. In other words, if we reduce other risk for cardiac heart disease, we could continue to use a drug that is known to cause heart attacks. The truth about Adderall is this: in 1994, Adderall became Adderall. And the funny thing about it is that it's a very old drug. It was formerly Obertrol. Obertrol was exactly the same thing as Adderall, except Obertrol was released in the 1940s. It was manufactured in Brooklyn by Obertrol Pharmaceuticals. And when Obertrol hit the market, it was advertised as a weight loss drug. Very popular drug, all the way from 40s until 60s. And then in the 70s, the FDA put out a bulletin and a warning to all physicians that they noticed that Obertrol was so habit-forming and caused mania in doses over 60 milligrams that the doctors heeded to the warning, and it could no longer be. Anyways, the makers of Adderall, Shire, acquired the rights, the drug like